Hi, I'm Dr. Chad Larson, and this is Keep It Real. Keep It Real is all about real talk based on my 20 plus years of clinical experience. What we're really talking about is real food, real medicine, and real change. Hello, and welcome back. Today, I'm going to talk to you about a trio of troublemakers. These troublemakers can significantly influence your health, for better or worse, depending on if they're in normal range or if they're out of range. These are laboratory markers that I'm going to talk to you about. But before I get to that, let me kind of set the stage. So what sets the stage are some troubling statistics. About 93% of the US adult population are somewhere on the metabolic spectrum. So metabolic syndrome is a particular condition. I've talked about it many times, but let me just remind you of what it is. So it's a constellation of 5 different issues: elevated triglycerides, elevated blood pressure, elevated blood sugar, low HDL cholesterol, and elevated waist circumference, 40 inches in men and 35 inches in women. So if you have 3 out of the 5 of those, you're considered to have metabolic syndrome, and your risk for many of the things that we're trying to avoid go up significantly, like heart disease, diabetes, overweight and obesity, cancer, neurocognitive decline. We're trying to avoid these things, and metabolic health is right at the centerpiece of whether or not we have an increased risk factor for those things. So over 10% of the US adult population has diabetes, and that's increasing every day. And up to 23% have no idea that they have diabetes. Pre-diabetes, 1 out of 3 US adults are pre-diabetic, and the majority of them have no idea that they have pre-diabetes. Almost 3 out of 4 US adults are overweight or obese, and that statistic keeps climbing. 25% have preventable non-alcoholic fatty liver disease. We call that NAFLD. NAFLD is very, very preventable, and actually has a lot to do with the trio of troublemakers that we're going to talk about today. 8 out of 10 of the top causes of death in the US are related to elevated blood sugar. We're going to talk a little bit more about that. And 95% of those who were hospitalized with COVID had 1 or more of these metabolic health symptoms. So that sets the stage for this trio of troublemakers. And what I'm not talking about in this video, we've talked about in other places about general cholesterol markers. We talked about glucose and the effect of blood sugar on our general health and function, and certainly metabolic health. But today I'm going to talk about some markers and some components of our physiology that you've probably heard of, maybe at least 2 out of the 3 you've probably heard of, but they're very, very important. I think they're undervalued in their importance. So the trio is triglycerides, which you've probably heard of. The second one is insulin, or insulin resistance specifically. Maybe you've heard of that. And then uric acid. Uric acid is a little bit less known by the majority of the population. But it's very, very key when it comes to general health, but certainly metabolic health. So what is the connection between this trio of troublemakers? Where it really starts is with blood sugar dysregulation. What I mean by that is glucose that has gone kind of out of control. Fasting glucose that you get on a standard lab test. If glucose is elevated, this is where a lot of the problem starts. But there's a secondary component here, which is insulin. Insulin is a very, very important marker. When people bring in their lab work from their primary care providers, I pretty much never see insulin on there. I almost never see uric acid. Triglycerides is usually a pretty common marker on standard lab testing, but we want all 3 of these tested, every time we get our blood work, at least, for general blood work purposes. These should always be on there. I almost never see insulin and uric acid, but it really, really, really needs to be on there. And hopefully I'll convince you of this by the end of our conversation. So what is this trio of troublemakers, and what does it have to do with their general health? There's interconnections between these 3, and I want to help you kind of connect the dots. So here's what happens is sugar causes insulin to go up. Insulin goes up, that's fine. Insulin is kind of it has lots of jobs, and so I'm going to oversimplify here, but basically it helps to open the door of your cells. It's kind of the key that goes in, opens the door of your cells, and then glucose is allowed to go out of the bloodstream into the cells to go make energy, which is what it's supposed to do. So that's what glucose does, but that's different than sugar. So sugar, which is in, sweetens your coffee, or you put it in baked goods, or it's in a whole variety of different foods and sweets, and it's all over the place. So, but sugar that we can use for those purposes is actually 50% glucose and 50% fructose. So let's talk about fructose for a second. Fructose is more famous for its, it's the sugar that's in fruit for the most part in pretty low quantities. So I'm not going to beat up on fruit in this video, but I'm talking about the much more concentrated form of fructose in the form of sugar, and certainly in high fructose corn syrup. So you might be thinking, oh, no, I don't use high fructose corn syrup. I've completely eliminated that from my diet. But if sugar is in your diet, you're getting plenty of fructose, because half of, sugar is fructose. It's 50% glucose and fructose. So you're getting plenty of fructose, and fructose operates completely differently in your body. There is no insulin effect like glucose, where glucose can be used by almost every cell in your body as a source of energy. Fructose does not do that at all. It just pretty much 100% gets metabolized in the liver. So the way it gets metabolized in the liver is it pretty quickly turns into triglycerides. So now I'm starting to make some connections between this trio of troublemakers, where an excess amount of sugar, which contains fructose, causes pretty immediate and significant elevations of triglycerides. Once the triglycerides are elevated from not only from fructose, but also from glucose as well, then we can start to develop, at least over time, something called insulin resistance. High triglycerides will lead to insulin resistance. It can also cause, just as a quick side note, that condition that I mentioned earlier called NAFLD, non-alcoholic fatty liver disease, really, really, really increasing common problem. And this oftentimes comes from excessive use of sugar, which contains fructose, causes overproduction of triglycerides in the liver, and then you get fatty liver kind of accumulating, fat accumulating around the liver, and that can really choke off the function and health of the liver. That's a little bit of a sidebar, but the connection between sugar, insulin resistance, triglycerides, and uric acid, the excessive amount of also fructose causes uric acid to go up. Uric acid is probably most famous and most well known to those who have suffered from gout. Gout is a very painful joint condition, oftentimes manifests in the big toe, but could also manifest in other joints as well. So what happens is an excessive amount of fructose causes an overproduction of uric acid. Uric acid can be evaluated on a basic blood test. As uric acid increases, it could cause these little uric acid crystals, which are like little daggers that form down in the joints of the toes, and it can be very, very painful. Those of you who have had gout really probably viscerally understand what that pain feels like. But it comes to uric acid. Uric acid is what causes that, and that comes from an excessive amount of fructose. Oftentimes, what is maybe historically thought of as the cause for uric acid that causes gout is like rich forms of protein, like pâtés and maybe shrimp and these kind of things that are very, very protein dense and protein packed. But as times have changed, the much bigger offender, at least in my experience, is fructose from overconsumption of sugar, which causes insulin resistance, and triglycerides tend to increase. So that's an important connection. So oftentimes people say, what gets measured gets managed. And so maybe is it that, general healthcare providers are not looking at uric acid and not looking at insulin because they either don't want to, or there's not kind of a perfect, clean solution for treating that. I think if I'm taking a more honest assessment of our healthcare system, I would say what gets measured and what gets managed has a drug for it. So I think oftentimes uric acid and insulin might not be evaluated on general blood work because there's not a perfect drug that goes with that. There's a drug for elevated uric acid. It's called allopurinol, but it's really only prescribed in people who have gout. So what if uric acid is just a little bit elevated? Nobody's going to really prescribe allopurinol for that. But there are some really important sort of diet and lifestyle components that we can do. Same thing with insulin. There's not really a perfect drug for insulin, especially mildly elevated insulin. There's metformin, but metformin is usually prescribed when somebody actually has diabetes. So I'm talking about that gray area where it's higher than normal, but it's not quite in the levels where somebody's gonna is gonna prescribe metformin. So there's no perfect drug for these. Triglycerides is not really a great drug for us. So, what gets measured, is what they have a drug for. So that's a little bit on the cynical side of why these things are probably not showing up from your primary care evaluation, because there's not like a super perfect drug that goes to help reduce these things. However, you don't need a drug for this at all. In fact, there's no way that we're going to drug our way out of this important connection of this trio of troublemakers: triglycerides, insulin resistance, and elevated uric acid levels. These are very, very treatable with diet and lifestyle. Of course, diet has to be the centerpiece, because what causes elevated triglycerides, what causes insulin resistance, and what causes uric acid to be elevated is diet, diet, and diet. So really the centerpiece to that is excess amount of sugar, not only because of the glucose that can be excessive, but also the fructose. Also processed foods, of course, even certain foods that don't have sugar added to them, they're so processed. Think of like grain-based foods, your crackers and chips and pastries and pastas and breads. Oftentimes these things don't have sugar added to them, but the grain that those are made with, the protein is sucked out, the fat is sucked out, the fiber sucked out. So you're kind of left with like a pure carbohydrate that by the time it hits your stomach, hits your small intestine, it's pretty much sugar, glucose, and it could definitely contribute to this problem. But for the center of the target that we're talking about with this trio of troublemakers, it's really sugar. The worst offender is probably liquid sugar, like sugar sweetened sodas, things like that, fruit juices. So this is the centerpiece to fixing it. A little extra bonus would be doing exercise. Your muscles are a sponge, or we call it a sink, for glucose. And as we exercise and we make our muscles work, they like to suck glucose out of the bloodstream and get utilized by the muscles as a source of energy. So that can be really, really helpful. You want to make sure you stay hydrated. Sometimes if uric acid kind of accumulates a little bit, this can end up in the kidneys. It can increase the chance, like I said, of gout, but also kidney stones. So making sure that you stay hydrated, that can kind of help the body flush out excess amounts of uric acid. Also, you want to make sure that there's kind of two sides of the coin. You want to avoid the stressor or the trigger, which in this case, I'm talking about sugar. But the flip side, you want to incorporate foods that support your metabolic health, like good, healthy animal proteins, good, healthy natural sources of fat, your olive oil, avocado oil, olives, avocados, macadamia nuts, those kind of things. And then also make sure you're getting a good broad variety of vegetables. I prefer generally, the low glycemic above ground vegetables, but you can get away with some sweet potatoes, things like that. Other fruits, berries, these have a little bit of fructose. So if somebody actually has gout, we have to actually be careful of even fruits in their case. But if you don't have that, if your uric acid levels are under control, you can certainly get away with some fruit. It's a great way to, have desserts, replace your sweets with fruits instead. Much, much lower concentration of glucose and fructose. So hopefully you understand that these trio of troublemakers is a real problem. Those statistics that I mentioned at the beginning really come down to diet and lifestyle, but oftentimes in our current healthcare model, these things are treated with drugs. But I'm telling you, we are not going to drug our way out of this. In fact, drugs have been used for the past, couple decades for these issues, and the statistics keep climbing and climbing and climbing. It's clearly not at all even coming close to working. So we have to get a hold of these important components to our diet and lifestyle. And also you want to get quantified. You want to evaluate these things in your body so that you can understand what your levels are, and that will help to dictate what you need to do to maintain your overall health and certainly your metabolic health. So be on the lookout for these trio of troublemakers. Make sure you get yours evaluated on a regular basis and you do what's necessary to balance them, because your health depends on it. Until then, keep it real.